what is the problem of the patient? Let's assume that abduction is painful. And I ask the patient, where is your pain? And the patient says, well, it goes down here, but it stays around the shoulder. Well, probably I think, well, maybe it's the shoulder. So probably I start with some mobilization with movement of the shoulder. So I just want to screen the shoulder, and if I don't get a good result, and the patient also says, well, my neck sometimes feels stiff, then probably it's a neck problem with a painful arm movement, so I would treat the neck. Probably I start on the level of C6, C7, and if I don't get a result, probably I have to go one further up or one further down, but pain around this region is probably lower cervical spine. So let's start on the level C6. So then I go really far out. I go probably out until here.
Rappelez-vous, la douleur, elle est de ce côté, donc on va pousser de l'autre côté. Donc il a repéré C7, du coup un étage au-dessus c'est C6, et il va essayer de se mettre vraiment à 3-4 cm de l'épineuse.
So I place my ulnar border against the soft tissue at the level of C6. And then I take 2 fingers, or if you like 3 fingers, I use my fingers to push my thumb across. So I start here, I take my hands here, they're giving a little counter pressure. I push across.
Et là, rappelez-vous, c'est une poussée transversale horizontale.
And it's quite a moderate to strong technique. Is that okay for you, Philippe? So I hold it.
Donc il demande au patient si la pression est bonne.
And now he's
il
doing
maintient.
a movement.
Et là, il lui demande le mouvement qui était douloureux, donc l'abduction de départ.
And I don't move with him. But what I can feel when Philippe is moving, that the spinous process slowly translates away from me. And this is what normally happens. So I just make sure that I push across, but I feel that then the segment of C6, C7 would like to move as well. So it could be this movement. With this lady with carpal tunnel syndrome, it was this movement. And I did the same thing. I was pushing across and then she had no pain anymore.
Et le mouvement accessoire reste le même. C'est vraiment une poussée transversale horizontale.
If Philip doesn't get any response, it's still painful, then probably I do it a little bit higher, so 1 segment higher or 1 segment lower. If it's painful still, I can use a sponge just to give him a little bit more grip, and also I'm not sliding too much. And then I know that I have a very good patient, so I show him what he can do. So I'd like you that you put your fingers on this spot here, and just it should be the same like I did it. Then you pull across, and if this is okay, then try to move your arm.
Et ça, c'est l'exercice qu'on peut donner aux patients.